Veins return blood to the heart from all the organs of the body. The large veins parallel the large arteries and often share the same name, but the pathways of the venous system are more difficult to trace than those of the arteries. Many unnamed small veins form irregular networks and connect with the large vents. Many veins, particularly those in the arms and legs, have one-way valves. Each valve consists of two flaps or cusps or leaflets with edges that meet. Blood, as it moves toward the heart, pushes the cusps open like a part of one-way swinging doors. If gravity or muscle contractions try to pull the blood back toward, or if blood begins to back up in a vein, the cusps are pushed closed, preventing backward flow. Thus, valves help return blood to the heart by opening when the blood flows toward the heart and closing when it tries to flow backward. The main problems that affect the veins include inflammation, clotting, and defects that lead to distension and varicose veins. The veins in the legs are particularly affected because when a person is standing, blood must flow upward from the leg veins against gravity to reach the heart. The legs contain superficial veins located in the fatty layer under the skin and deep veins located in the muscles. Short veins, called connecting veins, link the superficial and deeper veins. The deep veins play a major role in propelling blood upward. The one-way valves in deep veins prevent blood from flowing backward, and the muscles surrounding the deep veins compress them, helping force the blood upward, just as squeezing a toothpaste tube ejects toothpaste. The powerful calf muscles are particularly important because forcefully compressing the deep veins with every step. The deep veins carry 90% or more of the blood from the legs toward the heart. Superficial veins play only a minor role in carrying blood to the heart. They have the same type of valves as deep veins, but they are not surrounded by muscle. Thus, blood in the superficial veins is not forced upward by the squeezing action of muscles, and it flows more slowly than blood in the deep veins. Much of the blood that flows up the superficial veins is diverted into the deep veins through the many connecting veins between the deep and superficial veins. Valves in the connecting veins allow blood to flow from the superficial veins into the deep veins, but not vice versa. Thrombi can occur either in the deep leg veins, causing deep vein thrombosis, or in the superficial leg veins, causing superficial thrombophlebitis. Thrombophlebitis is a disorder in which the formation of blood clots, that is, thrombosis, and inflammation of the vein, that is, phlebitis, occur together. Because thrombosis is almost always accompanied by phlebitis, some doctors use thrombosis and thrombophlebitis interchangeably. However, there is an important distinction between deep vein thrombosis and thrombophlebitis. Deep vein thrombosis causes only a little inflammation. The less inflammation around a thrombus, the less tightly the thrombus adheres to the vein wall, and the more likely it will break loose, becoming an embolus, travel through the bloodstream, and lodge in an artery downstream, blocking blood flow. In addition, the squeezing action of the calf muscles can dislodge a thrombus in a deep vein, especially when a convalescing person becomes more active. Thus, only thrombi in the deep veins are potentially dangerous. Superficial thrombophlebitis is painful but comparatively harmless because thrombi in small superficial veins usually do not become emboli. Because blood in the leg veins travels to the heart and then to the lungs, emboli originating in the leg veins usually pass through the heart and block one or more arteries in the lungs, a condition called pulmonary embolism. The seriousness of pulmonary embolism depends on the size and number of emboli. A small embolus may block a small artery in the lungs, causing the death of a small piece of lung tissue, that is, pulmonary infarction. However, a large pulmonary embolus can block all or nearly all of the blood traveling from the right side to the heart to the lungs, quickly causing death. Such massive emboli are not common, but no one can predict which case of deep vein thrombosis, if untreated, will lead to a massive embolus. Thus, the doctors are greatly concerned about every person who has deep vein thrombosis.
So. Should I read that?